Hi, my name is Stephanie Roller, and I'm going to teach you how to open a cardiac cath pack and how to set up for a left diagnostic procedure and what additional tools we need for a STEMI. Before we open our tray, we want to make sure that we have appropriate PPE on. So we're going to have a mask, ear loop or tie mask is fine. And this is going to go on just our nose. We should all be semi-familiar with this from COVID, and then the loops just go around our ears. Then we have our hair net that goes on our head. So we want to make sure we get all our hair inside of our hair net. Kind of look like a lunch lady a little bit with this. And then we're going to do shoe covers for the procedure. So this is what our shoe cover looks like when it's on. And then there's just a hole. And so the longer part will go towards your toes. So we're going to slide that on. And then that's on our feet. To open our tray, if we look at it, there's this white tab. So we want to tear that to open it. And pull the tray out. This is now trash. We don't need this anymore. Sheet is also trash, but it just tells you what should be in there and if any items are excluded, what's excluded, because things go on back order. So then for this part, we want to tear these tabs. It says press here. I just usually tear them and tear. And so then now we're ready to open our flaps. And we're opening our tray on the table. We want to open away from us first, so that first flap, then towards us. And then we're gonna go and get our side flaps. Open whatever is on top first, so pull it. We always want to grip the edges, and so same for this side. We're going to pinch the edges like this, and then we're just going to pull it down. Anything that drops below this is technically considered unsterile. So all of this edging is unsterile, and so that's why we can touch to pull on that portion. If we look at our tray, we can see a few of the items that come on there already, but we're going to first drop our supplies into these empty spots so that we can set up the tray all at one time and we don't have to re-glove and re-gown. So some of the supplies we're going to drop on our table include gloves, one set for you and one set for the doctor. And so to open stuff, there's usually a side that is easier to separate, and you can separate the edges. But this is going to be our sheath, so we always want to pay attention to the French size, 5 French, and look and make sure this is going to be a radial sheath. We have our wire and our access needle and our sheath itself, so we want to make sure that this is the right one that the physician wants. So to open the product, once again, we're going to find our, especially with items like this, there's like a triangle. It's a little hard to see, but there's a triangle there. We're going to find our end that opens easier, separate our edges, and then we're going to peel it and kind of toss it on. So that we don't want to touch any of this as it's going on there, and we don't want it to accidentally bump our fingers or anything like that. So once again, we look for the little triangle is here, and then we're going to separate. So I always break our edges. And then we're just gonna split and toss. And then we have our diagnostic J wire, which is called a J wire because this little curve right here. So that's a little J tip, and that's important. And we look for our triangle, and then we're going to open. And with the J wires, you want to be a little more careful because they do have a tendency to bounce off. So we be careful when they throw those on there. This is our manifold kit. It's going to contain our contrast line, our fluid line, and our pressure line. We set this up once we have our patient draped, but this is important because it's what delivers the contrast so that we can see the images. It's also what lets us keep an eye on the internal pressure so that we can make sure that their pressure is not changing as we're engaging our catheters or taking images. Okay, so now with just our sterile gloves on, our hands are sterile, but we have to watch the rest of our body. So if we're touching or leaning to organize things, we might bump, or our scrub shirts are usually bigger, might be hanging out and hit the tray. We don't want anything that is not sterile to be touching our sterile field, which is all of this. So with just the gloves, our arm hair is exposed as we're reaching over all of this. So that's why I like to do it with a gown and gloves, especially once you're taking the catheters out of the pack, which we'll see later. You can accidentally hit your arm with those. So we're going to grab our gown, we pinch it off the table without touching anything else, and we're going to slide our arms through. Usually you would have another person in the room who is going to Velcro this top portion and tie your back. So as they're Velcroing and tying your back, you could put your gloves on. Once you have your gloves on, you're going to take your card and hand this tab off to your circulator. They're going to grab this portion and wrap it around you so that you can sterilely tie your gown and your back is protected. And because you have a gown on, you can lean and touch this table and you're not contaminating anything. And if your arm accidentally bumps something, you're not contaminating. So when I set up my table, I kind of start from one side to the other usually with my gown and gloves. So the gloves will go here. So my doctor's gloves will go first. And my gloves will go second. And then my gown. The next thing that's going to go to this side is going to be my drape. This packaging is trash. So we still have our gown and our drape. I'm going to then gather all my blue towels, and I like for all my towels to go the same way. So the seams up top go, and then this goes towards the bottom. So I gather all of those, and I'm going to put those over here in this corner. Next we have two of these trays. One I use to collect junk in the corner. We're going to use two of these, one for our x-ray shield that we don't see, and one for our eye. So these two I leave out. The other two go in my junk bin. Then I make sure I set up my bowls so that my circulator can put fluids in them. So I have a bowl for clean fluid, a cup for lidocaine, a cup for nitro, and a cup for verapamil. And then I have a dirty water bowl. Extra bowl goes in the corner. These are our 4x4s or gauze, and I stack those beside my towels. And then this bag I usually just throw away. We then have a bin with all our syringes, and there's different syringes. The 20cc syringes, I keep 2 for me as a flush with heparinized saline. 1 is going to contain my 50-50 mix of contrast and heparinized saline that we will later use for the endoflator. The small syringes, they are 1 cc syringes, are going to be ACT syringes, and I place those to the corner. All of the 10 cc syringes I save for flushes for my physician, so they get heparinized saline. And then my 2 3 cc syringes, I put one in my lidocaine cup, one in my nitro cup. This extra rectangle bin is now a bird bath, as we call it, which will get heparinized saline inside for my physician. ChlorPreps, here. The ChlorPreps are what we use to clean our patient's wrist and then their groin as our backup plan. So we use one for the wrist, one for the groin. This is going to be our sharps container. So after we use the sharp, we can puncture it in here. And I put this over to the side that is going to be closest to the physician so that he can put his sharps in there. This is our tray cover. I want to take our eyes off our tray, but maybe we're going to sit in the control room where we can see our tray and we're going to have a delay. We don't want to leave our tray uncovered in case dust or something falls. So we cover it with this plastic slip. Our trays usually contain hemostats and needle drivers. So we don't always use those, but I always keep them because I don't want to throw anything off my tray that we might need. Because as soon as you throw it off your tray, that's when a physician asks for it. So I put these in my drug bin. These are going to be our labels for everything. And we are going to label all of our medications and fluids. The bowls and the syringes. I always try to put everything long ways so that we don't cover the numbers. So here we can see that our cups are labeled and our bowl is labeled and they have different colors. And we also want to make sure our syringe is labeled correctly. So we have a purple nitro sticker on the syringe and a purple nitro sticker on the cup. And we know that those two things go together, and all our syringes and our yellow heparinized saline would be with yellow stickers. This is a final example of the tray and how it's set up. We just want to make sure when we set up our tray, no matter how we decide that we want to do it, we do it the same way every time, because that repetition is vital for those 3 a.m. call-ins when you're half asleep and you're blindly grabbing for something on your back tray. Your muscle memory will know where things are because you do it the same way every time. And that is the most important thing that we can stress on a tray setup. And this is a final example that you can screenshot and use as a reference. Thank you for joining me on how to set up a Cath tray. I hope this was helpful and that you now have a basic understanding of what basics you need